from the work of Turpo and Lanius in 2020. A traumatized brain during a threat looks the same as a normative, non-traumatized brain at rest. People with trauma at rest are stuck preparing for the next threat, thinking about the sense of self, the things that have happened to them, the past, where they are in time and space. It's difficult to learn like this. It's difficult to think like this. It's difficult to emotionally regulate. However, when something threatening happens, or there's a crisis situation, or somebody needs help, or a friend is whatever, or they're working in a crisis job, they're on, because this is what their brain has prepared for. This is the moment that they have vowed to themselves they would take care of something or keep safe in a way that they didn't when they were hurt in the past. Trauma doesn't just have to be violent sexual assault or physical violence or threatened death or anything. It can be attachment issues with a primary caregiver. It can be bullying at school. It can be emotional neglect. It can be exposure to violence or exposure to substance use. It can be a gamut of things. Anything that emotionally still affects you today when you think about it that has happened to you likely has had a traumatic imprint in your brain. A normal, healthy brain that doesn't have trauma has a sense of self in the present, sense of self in the past, can emotionally regulate, left and right communicate, front and back communicate. But under a threat, only the amygdala lights up because that's the fight, flight, or freeze response. It has to keep himself safe. A traumatized person, like we talked about, has the posterior cingulate cortex online when they're at rest, and then under threat is when their brain looks like a normative brain. So cut a person some slack the next time you find out that they have trauma, if it's kind of a hard relationship in your life, knowing that they're doing the best they can, and oftentimes they might pick out conflict or pick out drama because that's the only time their brain really feels alive. And they might not even realize they're doing it. It's totally subconscious.